Welcome to our final group project on the development of a clinical mental health agency. The Life of Go Center is the name that we chose, and the group members are Jahan, Chelsea, Hannah, and Christina. In Missouri, there is an increased need for counseling services within the geriatric community. Community members 65 and up have a higher risk for poor mental health and lack mental health services for individuals in the elderly age group. At the Life of Gold, we will tailor our programs using the lifespan perspective to be multidirectional, and multifunctional to account for the individual's interactions with environment and social factors. The pluralistic therapeutic model is also used as a collaborative technique that involves the combination of multiple elements from multiple theories. This multifaceted approach has had a positive outcome within the elderly age group. For those taking therapy, it keeps them involved, engaged, and motivated. Our mission at the Life of Gold is to assure geriatric community is provided opportunities and accessibility to mental health services. We will help with facilitating family support, providing direct care, and coordinating collaborative care by providing psychological assessment services, counseling services, direct care, treating mental health issues, and assisting with issues interfering with the senior's quality of life. We will walk alongside our clients and navigate together the uncertain challenges the client faces in life. We will provide support and compassionate care to empower clients to become healthy and resilient. Our vision statement is, as a dedicated and versatile team of clinical mental health counselors, we will transform the geriatric challenges through counseling to enhance life opportunities. In examining the gap of mental health services in Missouri, we found out that the geriatric patients require more inpatient and outpatient services for mental health. Our agency will offer both inpatient and outpatient treatment specifically tailored to the geriatric population. Our treatment facility will be offering inpatient services at level 5. The inpatient care will hold up to 25 clients with a stay of at least 2 months. However, they can stay up to 6 months for severe cases. We will require 5 to 6 therapists with up to 10 behavioral health techs to keep the facility fully staffed. We will provide services to the geriatric individuals who struggle with addictions, mental health disorders, and self-harm and suicidal ideations. There will be a specific schedule for wake up and bedtime so the clients can maintain a full night's sleep. They will also have a daily routine set so clients can adjust to being in an inpatient setting. Clients will also participate in group or a one-on-one care session once a day with counselors depending on their need. Clients will also have a scheduled recreation time to use for themselves, whether it be with staff or other clients, to engage in meaningful activities, games, or television. Upon completion of the inpatient program, clients will be assigned a caseworker. Each client will also be assessed on individual needs. This will determine if the client needs intensive outpatient, weekly group meetings, or one-on-one sessions before discharge from the inpatient to allow for a continuum of care. Life of Gold Center will also offer outpatient therapies, support, and case management. Our treatment facility will be offering an outpatient service at level 3. While getting treated in our outpatient department, we will promise several effective and efficient services, including collaboration and integration with your primary care providers, regardless of the system they belong to. Together, we will coordinate care, medications, treatment to ensure a smooth transition from inpatient to outpatient. We will offer mental health interventions by providing psychoeducation, individual, group, and family counseling. Also, complementary services such as yoga, art, and music therapy. Our program is intensive and will require at least 9 hours a week. The length of a program lasts from 3 to 13 weeks based on the individual's needs or progress. Life of Gold will assist the geriatric community with local services. Clients will be assigned a caseworker to assist with effective and efficient collaborative care. We will also coordinate medical care, medications, and treatment to ensure the smooth transition between care providers.
Community-based services. At the Life of Gold Center, we focus on the mental well-being of the aging community through resources and education. Community-based services for the aging community can include housing, transportation, and case management, just to name a few. Food insecurity is a critical issue for the aging community. Our agency will partner with local food resource programs to provide meals and tips for healthier food options throughout the community. Poverty, food insecurity, and poor nutrition have harmful impacts on the health and well-being of older adults. The Life of Gold Center will also focus on benefits for the aging population. Case management is designed to assist people with limited functionality and services. Case managers are vital to our agency. Case management is a way to ensure that needed services are being met for the client, especially those living independently. Senior case managers are trained to perform many different roles, but one of their chief roles is to present options to the seniors and their families to help them make the best decision. In addition to working with case managers, we will have a case manager staff that consults between the community agency to ensure adequate care and support for our clients. Health Insurance Portability and Accountability Act, also known as HIPAA, is a federal law put in place in 1996 to protect sensitive healthcare information from release without patient consent, according to the CDC. HIPAA gives clients the right to their healthcare information. In 2009, the Health Information Technology for Economic and Clinical Health, HITECH Act, was signed into law promoting meaningful use of healthcare information. There is a severe penalty for breach of HIPAA or high-tech confidentiality, and a company can be fined up to $1.5 million due to lack of security of the protected health information, or the PHI, if not in compliance. Our agency will comply with the HIPAA compliance checklist to ensure we are complying with HIPAA high-tech laws. Our staff will be trained on HIPAA compliance to reduce the risk of breach. To protect from HIPAA violation when answering the phones for clients' information, we must refer to a cannot confirm or a deny rule to protect client safety, especially in our inpatient services. Licensure and securing insurance credentials. To be a mental health counselor in Missouri, one must be a licensed professional counselor and pass the State Board Committee of Professional Counselors. This includes the necessary supervised hours and educational requirements from a CRC REP core accredited program. Our agency will perform an extensive background check to qualify candidates for employment as well as interns. So with these degrees, for educational requirements, this can include a master's, a specialist, or a doctoral level that is consistent of a major in counseling, which could be psychology, school psychology, etc. And it also requires 3,000 supervised counseling experience hours that can be full or part-time. To secure insurance for our agency, we must go through the process of credentialing and contracting. Credentialing is the process used to verify education, training, and professional experience. This is a time-consuming process, and our agency will have the required information and documents to make it as smooth as possible. Our agency will have a team dedicated to this process. For the insurance agency we hope to be credentialed by, such as Cigna, Medicaid, or Medicare. Our agency will need to provide information such as an NPI number, taxonomy code, licensure information, and practice address, just to name a few. The insurance companies we plan to collaborate with require a Council of Affordable Quality Healthcare application to gain licensure for their company. Due to this being a time-consuming process, we will have to be diligent in following up and making sure that we are on the right track. So for Cigna, our agency will have to make sure that it meets the minimum requirements for first-time credentialing, which could include liability coverage limits, which is different for each state. So we would have to understand what that would mean for the state of Missouri.
Standard A2A informed consent. This standard focuses on the knowledge and approval of what happened during the counseling process through documentation signed by the client. It is our duty as counselors to be honest about the counseling process. In honoring the code, we honor our clients as well. This standard allows our agency to offer services to clients that are aware of and have signed off on. Policy. Missouri law requires that counselors and clients are to have mutual understanding of the counseling process acknowledged by a signed consent form. The Life of Gold Center asks that all clients carefully review the form entitled Life of Gold Informed Consent for Counseling Services. This form explains services offered through our agency and confidential services. If a client verbally agrees to the information consent, we will document it and mention client concerns about signing if there are any. Upon completion of form of verbal acknowledgement, counseling services are to begin. Procedure. Once the client has agreed to informed consent and signed if they choose, staff will attach a copied consent form to the client file. Upon completion of document, each session following consent must be given and documented in the client's file. If a new service is requested, clients will need to fill out a separate consent form detailing the purpose for that service. If a client no longer needs the services, counselors are required to terminate immediately at the request of the client.
Technology and record keeping. Our agency will adapt to electronic health records due to the worthy benefits of this system, including financial, improved patient care, and office efficacy. There are different types of record-keeping systems in the United States. Electronic health record systems will provide the agency with better patient care. These systems will alert when mistakes are made and paperwork isn't submitted. To provide the security and confidentiality of HIPAA-compliant files, our agency will ensure that only authorized individuals have access to the system. Restrictions will be placed on employees. Only certain information will be available on a need-to-know basis. Other ways to ensure security is an access code that is emailed through the work email, and it will be asked for each time you log in. Technology and record keeping. The Life of Gold Center will use electronic record keeping. EHR is a digital version of patient's paper chart. The EHR system are just not for records only. They are an integrated system that can run a center's full administrative process. Research explains that electronic form of record keeping has greatly improved effectiveness, readability, and security of patient records while decreasing medical errors and improving patient care. It also improves the overall effectiveness and efficiency of the center by having access to appointment systems, billing systems, charting, orders, medication, and patient history. EHR can apply meaningful use. According to research, this applies to how our center will use the electronic record keeping to improve the quality of safety, performance, and health outcomes. We will do this by using electronic prescriptions and patient portals. By having this meaningful use of EHR by an eligible professional at our center, we will be able to enroll in EHR incentive program. This provides incentive payments for certain healthcare providers that meet specific requirements when using EHR technology to positively impact patient care. With the proper use of EHR, our center will not only possibly receive an incentive payment, but also create advanced safety, quality, and satisfaction.
Internal Agency Crisis Response. In our agency, our internal crisis plan will consist of a training course that will be continually implemented for training drills throughout employment. In our agency, we want our employees to be properly trained in crisis intervention to protect our clients and promote a safe environment. The company will have a composed emergency response plan approved by the state. In Missouri, there is a high rate of tornadoes, ice storms, flooding, and severe storms due to its geographical location. Other internal plans must include fire drill training. Because of society's impact on crisis, the company must prepare for shooters and bombers. For medical training, all employees will be required to have CPR, AED, and basic life training. Employees must be able to perform these actions in case of a cardiac arrest event and other events including choking, respiratory arrest, and burns. The company will need to implement a code research for emergency responses. The code will respond through colors. Code black is bomber, code red is fire, code blue is a medical emergency, code white is violent behavior, especially useful in our inpatient care, code purple is for shooter, and code green is for environmental crisis, including storms, tornadoes, floods, etc.
Because the Life of Gold Center is based in Missouri, our agency focuses a lot of our trainings on how to serve our clients during natural disasters that are common to the area, in addition to regular community crises. Our agency will work with the Missouri Department of Mental Health's Office of Disaster Services to help with training for our counselors, and our staff will be familiar with the Psychological First Aid Field Operations Guide, which focuses on how to help the community in all life stages dealing with the aftermath of a disaster or terrorism. Our hope is that our staff will be skilled in helping to configure resources for diverse communities after a disaster or crisis. Our agency offers a training camp on weekends to ensure maximum accessibility 4 times a year, and counselors will be required to attend one of these 4 retreats. Having these retreats will allow our staff to be familiar with required skills and tasks during natural disaster or crisis aftermath. Our staff will also be trained to work a crisis hotline. This hotline will offer referrals, tips for healthy coping, information on mental health resources, and crisis intervention. Training for this will include education on trauma-informed care and suicide risk prevention. All clinical staff are required to attend these trainings in order to best prepare for the potential risks that our clients may face from community crises, natural disasters, or just day-to-day stress that may cause them to call this potential hotline. Community outreach is something that is really important for our organization because we're serving a population that tends to be more socially isolated and very mistrustful of giving out private information. Therefore, we would like to partner with organizations that offer resources designed specifically for this population that have already built trust within the community. Our goal is to establish a level of trust within this community by showing that we are working with these trusted organizations, such as the Missouri Area Agency on Aging. Every state has a local area agency on aging that helps individuals with a wide range of services, including applying for benefits, educational programs, and assistance in a wide variety of ways. They also offer a specialized Older American Act that provides programs that target older people who have the greatest economic or social need in the community. This will help target lower income individuals or minority groups that may have extra barriers hindering them from receiving services. Because we have highly skilled case managers who are knowledgeable about insurance benefits and community resources, they will be responsible for working with outside organizations at least once a month. Eventually, the Life of Gold Center aims to create trust within the community and offer our own training programs that will help provide information on applying for benefits, encouraging the use of counseling services, and finding enrichment activities in the community. We would like to help the geriatric community as well as their caregivers. To provide comprehensive services to the geriatric community at the Life of Gold Center, we will form relationships with these 3 organizations. Providing collaborative care will really improve mental health outcomes for an overall healthier and happier lifestyle for our clients. One of the organizations we chose was the National Alliance on Mental Illness, and this will provide programs and education that will support our clients, families, and communities. The Substance Abuse and Mental Health Services Administration will provide practitioner training and another element to our center as a drug and substance abuse resource. Finally, the Area Agency on Aging, as I mentioned before, provides resources specifically to our population. They're also required to offer legal services, nutrition services, home services, disease prevention, and health promotion for the geriatric community. Each of these service areas include congregate and in-home outreach that includes transportation, information assistance, advocacy, outreach, and case management. So we definitely want to be working with these organizations to provide these similar services and also use them as a really strong resource. The Life of Gold Center offers various counseling services. We offer both inpatient and outpatient care that requires specific staff. Because this facility is a nonprofit, we only require the fees that will cover employee salaries, building upkeep, and non-necessary expenses for the clients. One of the biggest considerations for our facility is that we're dealing with a high-risk population. Individuals above the age of 50 have a higher cost of care. On average, a diagnosis like dementia, which is at higher risk for individuals over 60, costs an extra $1,247 per day in the residential setting. This is why each client will require around $5,600 per day for our residential facility. This may seem like a huge amount, but we have case managers that help with insurance and setting up payment plans for our clients. The initial Medicare enrollment period for individuals in America occurs at 65 years of age. Therefore, our case managers will assist individuals in receiving their Medicare. This is so important, especially for our facility, because we're lucky to be working with the population over 60 years of age. And Medicare will actually cover 100% of the cost of treatment for 20 days and 80% of treatment for the following 80 days after the initial 20-day period for individuals over 65. Our recommended length of treatment is 2 months or 80 days. Therefore, in theory, Medicare would be able to cover the majority of the cost of residential treatment for our clients. Medicare makes our treatment very affordable for clients while allowing the Life of Gold Center to pay its employees unnecessary fees. Outside of our residential center, we offer individual and group therapy as well as case management services. During our 3 to 13-week intensive outpatient program, we require a minimum of 9 hours a week, and this will include group therapy and individual therapy. So per week, the cost for our intensive outpatient program is around $180 in order to meet the needs of paying our therapists and case managers. Individual sessions outside of our structured intensive outpatient program must be paid hourly, and a lot of our fees were essentially basically based off of Missouri salary averages as well as general fees for building upkeep. So as you can see, our cost for individual therapy is $90 for a 60-minute session. $90 for a 60-minute session is the average cost in the United States for therapy. Our psychiatric care will cost around $72 per 30-minute session, and our case management will cost around $18 per 30-minute session. So for our clients who do not have insurance, we have an option for 20% of our clients at a time to stay without any insurance. So to be utilizing our residential services without insurance and therefore staying free of cost. So 20% of our client base will be around 5 clients on the unit who are staying for free. Because we are a nonprofit, this was a really great way for us to allow maximum accessibility. Because we are mainly getting a lot of our funding from Medicare and insurance companies, it's a lot easier for us to offer free treatment to a certain amount of clients on our unit at a time.